Okay, this is a video on inflammation testing that we're doing in our office. Some of you know I hired a nurse practitioner and a medical director because I really wanted to be more of a one-stop shop for people. I've been referring out to different specialties over the last 25 years, and sometimes it's great, and then sometimes it's not great. So I know when we're doing these things in the office, it's just more ways to help you get better, which is what we want, more ways to help you reach your potential. And one of those ways is this inflammation testing. This is a real cornerstone of what we do. And the reason for that is because inflammation is at the root cause of pretty much every disease known to man. So when you look at, there's a great article in Time Magazine a couple of years ago called The Secret Killer. And it says the surprising link between inflammation, heart attack, cancer, Alzheimer's, and other diseases. So inflammation is at the root cause of so many diseases. So like we just said, Alzheimer's disease, because it actually causes inflammation of the neural tissue in the brain. Heart disease, because it causes inflammation of the heart and the arteries. So things like high blood pressure, stroke, blocked arteries, because cholesterol actually clings to inflamed arteries. That's what causes cholesterol blockages. Cancer, inflammation turns on cancer genes as well. But then there's several other things. That's what I want to talk about in this video, including joint pain, allergy symptoms, sinus problems, a lot of other things I'm going to get to when it comes to histamine exposure, because what causes inflammation are these three things. So number one, chronic histamine exposure. Now, histamine is, if you think of like Benadryl, that's an antihistamine, right? So when you're stuffed up, people think, oh, I need an antihistamine, because histamine is what causes that inflammatory response. Like in the most of people, we think of it in like the sinuses and the throat and those things, which it absolutely does. But histamine has several other receptors in your body in different areas. So it can affect your digestion. It can affect your joints. It can cause joint pain. It can cause sleep. I'll get to this graphic in just a minute. And we're going to talk about how you find out about chronic histamine exposure. And then you have inflammatory processed foods that causes a lot of inflammation in the body. Toxins cause inflammation in the body. But what I see a lot of people doing is they're working on their diet and they're minimizing toxins, so they're trying to get more healthy products, personal care products and those types of things, and they still have a lot of symptoms of chronic histamine exposure, and that's what this test looks for. So the question here is, what's filling up your histamine bucket? So the way I look at this is, everyone has a bucket. And so if you think of all the cells in your body as buckets, the more histamine there is in there, it's going to spill over. And when it spills over, that's where you get all these symptoms we'll talk about here in a few minutes. It can cause bloating, insomnia, migraines, anxiety, digestive problems, flushing, allergy type symptoms that we just talked about. So I'll get over here in just a second. So the question is, what's filling up your bucket? So could it be some foods? Yes. Could it be some toxins? Yes. But so many people have underlying allergy issues, and some of it could be seasonal, right? And they have this underlying allergy issue that actually triggers a histamine response in the body. So you're constantly getting an overload of histamine, okay? So when you get this overload of histamine, look at the different areas that can be affected. And the thing is, you might not even know that the histamine could be causing this problem, but there's something you can do about it. You can get tested to find out if there's chronic histamine exposure, and then there's immunotherapy that you can do about it. You can eliminate this histamine exposure. So number one, it affects your sleep because it affects your brain. So if you have chronic histamine exposure, that could be causing insomnia, disrupted sleep where you wake up in the middle of the night, you can't go back to sleep. And then same thing, histamine receptors are in the respiratory system. So these are the kind of the seasonal allergy or allergy type symptoms, or sinus issues, or where you're always stuffed up, where you feel like there's this post-nasal drip sometimes. It can cause asthma, shortness of breath, runny nose, watery eyes, all of those things. That's a sign of chronic histamine exposure. But again, there's something you can do about all of this, or else we wouldn't be testing for it. It can affect your menstrual cycle as well. It can cause PMS, heavy periods, because there's a histamine receptor on the uterus. Musculoskeletal pain. This is a really big one for a lot of people, because we've been doing a lot more regenerative medicine and joint support for people. So if you're having chronic muscle pain or even chronic joint pain, so that would be like your knees hurt, you have knee arthritis, or like my elbow, low back, hip, any of those things where you have like these arthritic type issues, that can be caused by too much histamine exposure, because again, histamine causes inflammation, and arthritis is an inflammation. And then you have central nervous system, so that could cause, headaches, brain fog, vertigo, ringing in the ears. You get to the heart. This is a really big deal. High or low blood pressure, heart arrhythmias like AFib and those types of things. There's also something called POTS that affects your adrenal glands. So can affect all of those things. And then you get into gastrointestinal. So digestive issues like you would think of could be constipation, could be diarrhea, could be nausea, bloating, vomiting, any of those things. And then skin, so eczema, hives, if you're having problems with your skin, flushing of your skin. Again, all of those things, and this is another really big one, excess urination or overactive bladder, because a histamine response in the bladder is going to cause you got to get up, in the middle of the night and go to the bathroom when you shouldn't have to. So all of these things are symptoms of chronic histamine exposure. So how do you find out if that's going on? So here's the deal. What we look for is that if you have, if there's all the things that you come in contact with, especially, in our modern day, but seasonal things like, so, things that are in the air, tree things, tree allergens, different seeds allergens, environmental allergens, all of these things can cause this chronic histamine elevation in your body. And that's why it's important to get tested to find out if you have that inflammation that could be causing all of these things. It's a simple test. So we look for the different allergens, and there's dozens and dozens of these allergens that we look for to see what could be causing the histamine exposure. The test and the immunotherapy that follows is covered by most medical insurance, which, including like Medicare and all the Medicare Advantage plans, which is great. I'm 100% covered, which is fantastic. And they actually cover the immunotherapy. So the test only takes 15 minutes. And if we find out that you do have the chronic histamine exposure, there's immunotherapy that comes with it. So you can actually help the immune system learn how to deal with these allergens. And when it does that, it reduces your histamine exposure. And that's where we see people feel so much better. So super simple. So if you're interested in doing that, just let us know at the office. But that's what this entails. And I'm really going to start testing pretty much everybody I can. Because when you see this, like I had a patient who went through this not long ago, had horrible issues with postnasal drip, sinus problems all the time, a lot of brain fog. So if you go back and look at this, he was dealing with brain fog, all of these issues right here. Also had a lot of pain in his joints, and then digestive problems. And lo and behold, so much of that was caused by his histamine, right? So we started working on the immunotherapy, changed it, worked on his diet a little bit, getting rid of some of the inflammatory foods. And lo and behold, doesn't have the allergy problems anymore, is sleeping normally again, doesn't have the brain fog. You feel like his brain, he's like, I feel like I could actually put words together again. Doesn't have the digestive problems anymore because, again, we got to the cause of the problem. So, again, it only takes 15 minutes, done by our nurse practitioner. And it's a phenomenal test that really shows you how to get to the root cause of that inflammation that I've been talking about really for 25 years. So can't wait to hear from you on this. But if you want to do that, just let one of the team know at the front desk or let me know, and be happy to get you tested.